So now we'll talk about acute renal failure, okay? And I will explain what exactly acute renal failure and what is causing acute renal failure. So we have to know there are three reasons why we could have acute renal failure. First of all, either it's something pre-renal, I mean causes that happen, something not related to the kidney, so before the kidney, so we have a problem, and then we would develop the pre-renal failure. So what is actually acute renal failure? So acute renal failure, it's reversible. There's something called glomerulus filtration rate, GFR. So from the name, G, it stands for glomerulus, F for filtration, R for rate. So if the volume of the urine become very low and there's a retention in the fluid, so the edema in the patient, so the fluid retain in the body, so that means there's a reduction in GFR. So glomerulus, they are not do their job properly, the filtration doesn't happen or occur normally. That's why the fluid will stay in the body, will be retained in the body, the sodium and everything, so blood pressure will be high because we cannot excrete normal urine. This is called acute if it's reversible. We'll talk about the reason now. As we said, we have a pre-renal reason, and we have post-renal. Any disease cause acute failure, not in the kidney, from either in the ureter or bladder neck, but not in the kidney. And we have intrarenal. The cause are related to renal itself. So in prerenal case, we have either erythrosclerosis or ischemic. So either we have a problem in the heart, so the cardiac output become very low and blood pressure very low, and that will cause stress on the kidney, and the kidney will fail. If the causes didn't treat it, okay? Or maybe employees. So employee can suddenly block the blood vessels, that go through the blood, and then there will be no blood coming into the kidney, and that will cause kidney failure. And also we have the post-renal. So in post-renal, there will be obstruction in the urine flow. So the obstruction may be caused by kidney stones, whatever is the type, and also maybe benign prostate. So we know that prostate gland, it's located here. If they enlarge, they will block the urine to come through the bladder, so the urine will go back, so there will be retention in the urine, and that will cause inflammation to the kidney and damage. Or bladder injuries, sometimes, trauma or whatever cause to bladder, and that will cause the urine to, retain in the ureter and cause kidney inflammation. Intrarenal. In intrarenal causes, we have either trauma, so direct trauma, like if the patient exposed to an accident and there was direct trauma in the kidney, or inflammation. Inflammation could be caused by, a bacterial infection, viral infection, whatever. Autoimmune disease, that some, systemic lupus, for example. So there will be an antibodies that attack the kidney, and infection as well. So, and drug. So some type of drug, like strong antibiotics, that can, one of the side effects of them is kidney failure. Now we'll talk about chronic renal failure. There are different causes that can cause chronic renal failure. One of them, which is acute renal failure. If the patient has an acute renal failure and it doesn't treat it, the cause doesn't treat it, that can be developed to become a chronic renal failure. As well, hypertension. So if the patient have a very long history of hypertension, I mean high blood pressure, so hypertension, the patient can develop chronic renal failure. And as well, diabetes. So diabetes is one of the leading causes that cause chronic renal failure, and the disease related to diabetes, it's known as diabetes nephropathy. We'll talk about it in detail now. And then other cause, it's kidney disease. Kidney disease, like as we said, autoimmune disease, that with time, the antibodies keep attacking the nephron, that would cause inflammation, and then would start to lose some nephrons. So the kidney will not be, the number of nephrons will not be sufficient to clear all the blood. And with long term of the disease, patient can develop chronic renal failure. So we'll talk firstly about hypertension. So we need to know that hypertension is controlled by two major things. The blood pressure. The blood pressure controlled by two main things. One of them is the resistance in the peripheral blood vessels, which is causing hydrostatic pressure. So, and then the volume. Basically, what happened in hypertension? So, hypertension and renal disease always going together. And it's still be questioning whether the renal disease start or hypertension start. They cause each other. What we want to know, basically, if the hypertension, it's considered one of the blood vessel disease. It's a disease related to the blood vessels. So we have problem with the blood vessel. But again, hypertension can be caused by kidney disease as well. If the disease has a problem, it can be developed to hypertension as well. In this case, we'll explain basically what's gonna happen in hypertension if it's a blood vessel disease. What will happen basically because of the hypertension? So the blood vessel will be, the vasoconstriction will increase, in the blood vessels, peripheral blood vessels, and there will be a really, if the blood pressure will not be controlled, and it will always be hypertensive, so then the patient, these vasoconstriction will also with time cause damaging to some of the blood vessels, and also increase in the increase in vasoconstriction will decrease the blood volume. So the blood will reach to the afferent will be very low. So the sensor in glomerulus will sense that the blood volume is very low. So what will happen then? It will produce renal to increase blood vessel secretion. So the RAS system will be activated. One of this is renal to moderate or to bring the blood volume to the normal. So when the renin will be secreted, so that what gonna happen? So more vasoconstriction will happen. So that will increase the vasoconstriction, because we can increase the blood pressure by two things, either vasoconstriction or the blood volume. We cannot increase the blood volume in this case because we have problem. So what the body will do will increase the vasoconstriction, and again that will cause more pressure. With time that will damage the nephron. So depend how many nephron we are gonna lose because of the hypertension. The patient will, the GFR will reduce, and we have different level before we reach to the end stage. So we have 5 stages before we reach, the end stage, in the stage, the GFR is below 15%. Okay, we'll talk about this later. So as we said, because of the blood volume coming into the kidney, so because of the blood volume that coming into nephron is very low to the glomerulus sensor will produce renin and the whole RAS system. So to increase the absorption of sodium chloride through aldosterone and water through antidiuretic hormone, and here aldosterone, okay, and here antidiuretic hormone, and renin will cause more vasoconstriction of blood vessels to increase the volume. Unfortunately, the volume will not be increased, and then with time that will cause damage to the glomerulus. Okay, the high volume of sodium, water, and because the kidney will damage, it will cause with time edema. So the fluid will be retained in the body, and the patient will be, we can notice the edema on the patient. In case of diabetes, patient with long term of diabetes and controlled blood sugar, so the blood sugar will, the glucose will accumulate in the blood vessels, causing an inflammation, production of growth factors, cytokines, that will cause damage in the blood vessels, not only in the peripheral blood vessels, as well in the glomerulus, which will cause oxidative stress, and patient with time will develop a disease called diabetes nephropathy. I'll explain in this slide. So in diabetes, we have both hypertension and hyperglycemia, because patient with time, because of damage in the blood vessel, will develop hypertension. So it will cause glomerulus hyperglycemic and will cause glomerular hypertension, will cause proteinuria. What is proteinuria? That we can see protein in the urea, in the urine. We'll see protein, which is not normal. We'll see fibrosis, so the glomerular and interstitial fibrosis, so this tissue will switch from kidney or nephron into fibroblast. The GFR will be reduced, and then again patient will have renal failure. So both patients will develop something called glomerular sclerosis. Glomerular sclerosis, which means that the glomerular are damaged. Talk about manifestation of the disease now. So in terms of sodium and water, so the manifestation, what's going to happen, because the GFR will be reduced, GFR, okay, and then the sodium and water will be retained on the body. That will increase blood pressure, okay, will cause edema in the patient, okay. So then we have to control the blood volume by restricting the fluid for the patient, okay, the fluid intake. So in case as well of potassium, so what's gonna happen, in case of potassium, so the GFR will be low, okay, and that will cause the hyperkalemia. So the potassium volume will increase, because the potassium is control the muscle movement, okay, so there will be muscle weakness, because we have a very high concentration of the potassium in the blood, and that will affect the way that sodium potassium pump work and move the muscle. And also ECG, so ECG as well heart is a muscle again, and the ECG will change. So the electrocardiogram, so the one we do to read the function of the heart, and that will cause fibrillation. So the hyperkalemia will cause fibrillation and arrhythmia that increase the heart or irregular heart beats. And if the nephron will be lost totally, the nephron will be lost totally, that also will reduce the renin production, so there will be no renin, and then no aldosterone, because both are reduced by lung, okay? And then again, that will affect sodium-potassium pump, the function of them, and it can cause death, okay? In metabolic acidosis, what's going to happen because of the damage in the kidney and the GFR not working normal, so the hydrogen excretion will be reduced. So the hydrogen and bicarbonate both will retain in the blood, causing acidosis. And with time, this acidosis will cause the discalcification of the bone. So because of the acidosis, bone will be this spelling is wrong, declassification of the bone, okay? Finally, we'll talk about mineral balance and osteodystrophy. So because of the damage in the nephron or loss of nephron, that will cause the calcium, okay? It is a form of active form of vitamin D that's produced by kidney, will be reduced because there's no kidney to produce enough calcium, and that will affect calcium absorption as well. So we'll not be able to absorb calcium from our diet, and will reduce the reduced GFR as well will cause hyperparathyroidism. So the parathyroid gland size will increase, and it will cause the reduction in calcium, secondary hyperparathyroidism, and that will cause as well osteodystrophy. So we'll start to reabsorb the calcium from the bone instead of, as if you remember, the parathyroid hormone. It's a hormone that produced by parathyroid gland, and it will increase the absorption of calcium from the bone into the blood. So from bone to the blood, and that will cause the osteodystrophy. So the patient will suffer from osteodystrophy. So this is a manifestation of the kidney disease. As well, renal production will reduce. That will reduce blood pressure. Also, erythropoietin, it's a protein that controls the RBC number, will be reduced. That will cause anemia. Calcium, as we said, will reduce, and that will cause osteodystrophy, as we said. So a lot of complication. We will have also uremia, so increase of the urea in the blood, and that will cause like patches on the skin of the patient because of the toxicity of the ammonia. Also the creatinine, there is something called creatinine clearance rate that will collect a urine for 24 hours for the patient to know how much creatine we are clear in the blood. If the creatinine clearance rate is very low, that means the creatinine are accumulated into the blood, causing the patient to have high toxicity of creatinine. Finally, we'll talk about stages of the disease. So at stage 1, when patients are normal, 90%, the GFR is above 90%. As we go down, so the kidney failure, it's 5 stages. Stage 1, where still the GFR is normal. In stage 2 as well, still 60 to 90, 89% considered normal. But from stage 4, the kidney function is very low and treatment for kidney failure may be needed soon, because the GFR reached 15 to 29%. Last stage or end stage, when the GFR is below 15%, can no longer keep up with removing waste product and extra water. This is called kidney failure. The only treatment option in this case is kidney transplant for those patients. That's it for renal pathophysiology.